Okay, welcome back. Thank you so much for joining us. We're really excited to continue this really important conversation about influenza vaccinations, and really empowering PAs to go beyond and really recommend the right influenza vaccine for their patients. I'm Jennifer Orozco. I am the Chief Medical Officer for the American Academy of PAs, and I am joined today by several PA experts, our PA to Takeia Horton, Dr. Sarah McQueen, and Dr. Melissa Soester. And so thank you so much for being here. This discussion, which is supported by Sanofi, is really timely and really important as we move into vaccination season, and into influenza season, I should say. And I want to shift our focus. We've talked a lot about data. We've talked about the importance of communication, and understanding how the right vaccine formulations for your patient population. So I want to talk about something that I think we want to raise awareness of is that certain patient populations have higher rates of hospitalization for flu outside just the normal older adults. I want to give some statistics here because I think it really will set the tone. So compared to white patients, age-adjusted flu hospitalization rates were nearly 2 times higher among Black patients and 1.2 times higher among Hispanic or Latino persons. In regards to flu-related ICU admission rates, compared to white patients, 1.7 times higher among Black patients and 1.1 times higher among Hispanic or Latino patients. So those numbers are pretty staggering, I think, and pretty impactful. And, you know, before we move on to really kind of steps that you can take as a provider for some of the most vulnerable patient populations, I thought I would just ask the group, can you share with us, have you experienced this? Have you seen this in your own practice? Dr. Soester, I'm going to start with you. Are you seeing this? Do you see differences among these patient populations that I just mentioned?
Absolutely. And that's something that I think it becomes even more important to talk to patients about, that no matter what they're in the clinic for a visit for, to let them know, hey, you need to get an influenza shot this year, whether it be high dose if they're over the age of 65, or whether they can get a standard dose, but just letting them know, here's the facts. You know, if you are a Black patient, your risk is twice as high of ending up in the hospital with this. And you want to provide those statistics, not to necessarily scare them, but just to be transparent about what's actually happening in certain patient populations. So just letting them know, here's your risk of that and where can we go moving forward.
Dr. McQueen, your experience, I know you have some of the school-based centers and some others.
My experience, it's different what I see. So I am in a rural area with a mostly white population that I take care of. But what I do see, and it's kind of age related. It really is. You know, back in my day when I was in PA school, your GFR was calculated differently if you were African American, even though there was literally no scientific evidence that you should do it. It was based off of racist assumptions in medicine. But here we are for years allowing our African American patients go into renal failure before our white patients because we were relying on this lab value. And when I first learned that, I was repulsed, and I went through my charts and looked up all of my African American patients. You know, that's how many that we have, and just to make sure, because it's mind-boggling that we were taught, and for years that's how I practice. So of course those populations are going to end up in the hospital. We have let them get sicker, and the same is true with pulmonary function tests. They have guidelines in those numbers that allow our African American patients to suffer from asthma and have more severe lung problems and poor control. And so this is something that is very real. And but then it's also, from my perspective, because I don't see a lot of diversity, it's mostly white. sometimes you can forget the things to look for and the risks factors that are associated. And so it's making that conscious decision of, okay, I am going to take the time on this one because this is someone who typically does not have access to the best care, or can get lost in the system. And it's kind of like, I kind of look at it as QI/QA, and if you didn't shudder at that, you will. If you're a newer PA, eventually you're going to go, oh, don't say the Q word, because you can't address everything at every visit. But if you can pick one or two things each week, that's your focus. And so it's kind of looking at it like that. When you have any of these ethnicities that have poor vaccination rates and poor outcomes in the hospitals, you're really, when they walk in the door, you're hyper focused on making sure you are giving them the best care possible, not better care, and you're not singling anyone out, but it's you are hyper focused on a segment of a population that literally statistically needs help.
All right, PA Horton, I want to turn to you because we're talking about one of the areas of your specialization, which is really some of your work in underrepresented and minority groups. And so we just heard from Dr. McQueen talking about some things that we've, started to talk about in medicine that we really didn't talk about before, and the changes that we're making for some of the biases and the racism and the stigma that has been in medicine for quite some time. So what are those other considerations that PAs, no matter where they're from, need to be thinking about and considering for their patients?
So I think a couple of things that we need to think about when you're working with populations, and anybody really, for vaccination, or whether it's talking about chronic comorbid conditions, is thinking about things like access to healthcare. There are several areas that are health professional shortage areas in the country where people may not have access to medical professionals. So therefore, vaccination uptake rates might be decreased as well. Also, you want to talk about things like cultural competency, and it goes back to making that relationship and that rapport with your patients. And if they have concerns about stigma or issues with trusting medications or vaccinations, you want to help dispel some of those myths and dispel some of that mistrust and educate them to the best of your ability, and then help them to make a mutual decision on vaccination. And like someone had said previously, they may decide not to get that vaccination today, but you did your very best in providing them with updated information, resources if they're in an area with less access to healthcare, and then they may come back, and at least they will know that you are someone who helps to answer their questions and who is helping to build that rapport with them as well.
And I think we talked about in the last segment a little bit around communication and building that relationship with your patients and why that's so important, and meeting your patients where they're at. Where I've seen providers fail, and this is not just PAs, it's nursing, it's physicians, is really not meeting folks where they're at, right? And really this kind of scolding, or I'm telling you need to do this, so therefore you should do it. And really, instead of taking that a place of understanding and empathy, understanding there are cultural factors and social factors. And I think where we've seen, and I know, in my role as chief medical officer, I've seen some really great work, especially in communities, and how important it is as a provider to be involved in your community where your patients live. There's a lot of things that you can do, and partnering with community leaders, and especially when there's the cultural and the social piece to overcome. And they can really help you think about your approach and your relationship with your patients. And I think that's so important, especially in some of the most vulnerable populations. And so really understanding the numbers and being able to answer patients' questions is really so important. And I think this is all of our responsibility as we continue as providers, as PAs, and it's really to look out for every single patient that's out there, regardless of their background, their race, their ethnicity, where they're from, and to make sure that we're giving them all of the information that they need to make the best decision possible with you. So thank you so much. This has been a great talk, and we're gonna move into our next segment here. And we're going to talk about really every PA in every setting making recommendations for flu vaccines. So stay tuned, and we're going to be right back.